Hello, this is Dr. Alexander Dayanak. I'm a general dentist here at Steinway Family Dental Center in Astoria, Queens, New York. We get a lot of questions about laser dentistry. So today we're going to answer some of those questions. Laser dentistry has benefits compared to traditional dentistry in the way that you can get, for example, fillings, and you can do that without any injections. So if you're using a laser and you're hitting the tooth for 40 seconds, the nerve inside the tooth goes to sleep, and then you can even drill the tooth and you don't feel any pain from that. So it also makes it faster. Also, when you put the filling in, then you can use the tooth right away. As well as if the decay comes closer to the nerve, I can come closer to the nerve with the laser than I can with the burr, and the patient still doesn't feel it. So it's a wonderful way of doing fillings when you don't get any pain from it. So amazing stuff. Another thing that you can do is the soft tissue or the hard tissue, right? So you can also cut the gum with the laser instead of cutting it with the blade, and there's no bleeding with that and less pain. You can even do it without injection. So again, amazing. So there's few different groups of procedures that could be done with laser. Number one, let's say fillings, right? So the filling could be done with the laser, and with that you don't get injection. And with the laser hitting the tooth goes dormant, and we can clean out the decay and then put a filling in it. Now we can go as little or as much as we need it to clean the entire decay. So there's a little bit of a difference in the design of the preparation that's possible, and the tooth is saved a lot more. A lot more of the tooth structure is saved, and we can use that to restore the tooth and become healthy again. That's one thing. Another thing you can do with a laser is, for example, in the sleep apnea. Some patients, you know how with age we get face that is sagging a little bit, like there's creases and so on. So the same thing happened with the soft palate, and when the soft palate goes and closes out your throat a little bit more, it's not as strong as when you're younger, so it claps a little bit, and people snore because of that. So if that is the problem, when your partner is kicking you that you're snoring and don't let them sleep, what you can do is we can hit it with a laser a certain way, and that will elevate your palate and make it strong again, and therefore you're not going to snore, right? Or you can improve your snoring condition. So that's another thing that you can do with the laser. The next procedure we're going to discuss is gingivectomies. What is that? Like, for example, you have like a hood going over the coronal portion of the tooth. So sometimes people have very, very small teeth because the gum is overgrowing it too much. So that gum could be increased, and you can do like McDonald's arches around your teeth a little bit higher, and the tooth is going to look a little bit fuller, and the smile is more beautiful with that. So that is something that could be done, with the blade, right? When you can cut it with the blade, or with the laser. And when you do it with the laser, it is more comfortable for the patients. There's less bleeding, and it could be used right away. So there's no downtime. Now, the safety procedures, there's a safety glasses that you're supposed to wear, because a laser, it has to do with light, right? So you're not really touching anything with the light. The light is touchless drilling or touchless cutting. So you use specific glasses that prevent your eyes from being damaged by the laser. Other than the glasses, the lasers are very safe to use, and there's really not much needed for the safety of the use of the laser. Well, about 10 years ago, I had my first laser. And at the time, the laser that I had, I remember that I was using it for fillings, and I used my knees as a guinea pig for that. So it took me 40 minutes to try to do a small cavity, and then we just give up and I used the burr, and that was fine and fast. So today I can do the same procedure in literally 2-3 minutes, and the cutting of it would be less than a minute. Yes, when you need to take a crown out, let's say it is a metal crown and you want to take the crown off, the laser would not be the correct choice for it. You would still use the burr for that. Well, I take a lot of extra credits every year, and also I do go for different conventions, like, for example, laser conventions was in October that I visited in Houston, Texas. That was for Soleil laser. There's other laser clinics that I participate with and get more training on using the laser. I do have this particular patient that was snoring really hard, and of course it was affecting the family, right? The spouse was not happy with him, and after we did this sleep treatment with him with Soleil laser, then he stopped snoring altogether. So I have a happy couple on my hands now, and that is basically the purpose. We want to make your life better. Also, I have patients that are terrified of getting injection or using the drill on them. And we use laser for those patients, and they're completely happy because they haven't experienced that before. They would not go to the dentist because they're scared of getting injection, needles, pain, right? And they get it with laser and they don't feel anything. It works wonders for children because they don't want the needle, they don't want the drill. And we tell them that we're going to play with this laser, and we show them, and they totally fine with it. So it is a blessing. Well, in order for you to use laser, you do have to be certified. You have to take specific training. You have to know how to use the laser, that it is safe and efficient, and you're not getting any harm done to a patient or the staff around you or to yourself. Well, we help them to make a decision what they're going to treat. And by showing them what we can do for them, they can understand that it's much easier than they had experienced before. Because right now with the laser, it's so much faster and easy and painless that it's easier for the patient to accept the treatment and get it done and go through with it. Well, the most common misconception about laser is that can it be used for dentistry, or am I a candidate for it? And yes, you are. Anybody could be a candidate for laser dentistry. Just have to come in and let us show you what we can do for you with the lasers. There are patients that have chemotherapy or radiation therapy, and they're afraid to come in because they don't want to get exposed. Now, what laser does, it kills all the bacteria in the area as well. So it is actually more beneficial to use laser than using regular stuff. If you need any dentistry, you can call us here at Steinway Family Dental Center, and I will personally use my laser to help you with that. So the telephone number here is 718-728-3314, or you can find us online at alldentalneeds.com and request an appointment.